Hello, my name is Brittany Riley, and today I'm going to be doing the intradermal skills video, intradermal injection skills video for Nightingale College. So first thing is I've gathered all my supplies. I have my patient, I have my alcohol swabs, gauze, sharps container, hand hygiene, trash can, gloves. I have my medication, which is tuberculin. It's 5 TU per 0.1 milliliter. And like I said, we're going to do this injection is intradermal. I have my syringe, which is a 1 milliliter syringe. It's a 25 gauge syringe with a 5/8 inch needle. So, first things I'm going to do is I'm going to verify the order with the MAR and make sure that I have the 6 rights of medication administration, which is right patient, right medication, right time, right dose, right route, and right documentation. And I have all of that. So I'm going to verify it with my MAR, and I'm going to take my supplies into my patient's room. I'm going to knock on the door and ask to come in. I'm going to introduce myself to the patient. Hi, my name is Brittany. Today I'm going to be your nurse today. How are you feeling? Great, I'm glad to hear that. So we're going to be giving you I'm going to explain my procedure. We're going to be giving you a tuberculosis check, which is checking for any exposure to tuberculosis. So before we get started, do you have any allergies to any food, medication, or any environmental allergies? No? Great. Also, can I please have you state your full name and date of birth? I'm going to verify that on my patient's wristband, and we are good to go. So before we get started, this will only take a few minutes. What we're going to be, some common side effects for the injection site will be stinging and burning. That will subside. It's with every injection. Some common side effects are itching and swelling, and some adverse reactions would be shortness of breath and hives. So if you're feeling any side effects, please let me know immediately. So now that I'm at the bedside, I'm going to verify my medication again with the MAR, and I'm going to see it's tuberculin 5 TU per 0.1 milliliters, and we're injecting it intradermally. So I'm going to first close my curtain and provide privacy. I'm going to perform hand hygiene, and we're going to get started. So I'm going to put my gloves on. I'm going to grab an alcohol swab. I'm going to uncap my vial, and I'm going to make sure that I get the top of this vial clean with the alcohol swab. This needs to dry. I'm going to grab my syringe. And without uncapping, I'm going to grab or draw up 1 milliliter of air carefully. So I have 1 milliliter of air. I'm going to uncap my needle, and I'm going to inject this directly into my vial. I'm going to make sure that that air is inserted slowly, and then I'm going to invert my bottle, and I'm going to draw up, making sure there's no air bubbles, 0.1 milliliters. And I'm going to tap my syringe to get all those air bubbles out. And I'm going to pull my needle out, show the camera that I have 0.1 milliliters, and using the 1 scoop method, I'm going to carefully scoop my needle, and I have this ready to be used. So I'm going to remove my gloves at this point. And then before I get started, the injection site should be 3 to 4 fingers away from the cubital area and about a hand width away from the wrist. So it's going to be in this area here. After you're going to slightly palpate the area and make sure that there's that everything is fine and ready for the injection. You're also going to keep watch for any rashes or discoloration, anything that is wrong with the skin. My patient looks great, so I'm going to get started with her injection. She's a sheep, I guess, today. Okay, so I'm going to perform hand hygiene again, and I'm going to re-glove. Okay, and I'm going to take my alcohol swab, and I'm going to circularly disinfect the area, keeping a circular motion about 2 inches away out of the injection site. I'm going to make sure that air dries, and then with my injection, I'm going to make sure that my needle is at a 5 to 15 degree angle. I'm going to make sure that my bevel is up, and I'm going to insert my needle about 3 milliliters. So my patient is ready to go. I'm going to cap that there. With my non-dominant hand, I'm going to pull the skin, and I'm going to put the bevel up, and I'm going to go in at a 5 to 15 degree angle, about 3 milliliters. I'm going to slowly inject my medication, and at this point you will see a slight wheal or a bleb. So we're going to go ahead and pull the needle out with our gauze using the 1 scoop method. Oh no, we're not using the 1 scoop method. We are putting our syringe in our handy sharps container. So anyways, you'll grab a gauze, and you want to make sure that you don't put any pressure on the area. And after that sits for a little bit, we will remove our gauze. At this point, we can clean up all of our areas. We want to make sure that we tell the patient also to try not to itch the area, or it's okay to shower, but since they will have to come in 3 days later, or this test takes 2 to 3 days to process, so we want to make sure that we try not to give the area too much attention. So I will remove my gloves. Clean up my area. And at this point, I'm going to get ready to document. I'm going to perform my hand hygiene and make sure that I continue to monitor my patient, seeing if any of those side effects do come up. I'm going to lower my bed, the patient's bed, to the lowest level, make sure the call light is in reach. I'm going to ask my patient, do you have any questions for me? They say no. I'm going to thank them for their time and being such a good patient. And if they do have any questions or concerns, to please not hesitate to reach out to me. And then I'm going to go ahead and go document the right patient, right time, right dose, right medication, right route. And I'm going to also mention the injection site when I'm documenting to the provider and for the rest of the team. So yeah, performed hand hygiene, documented, and we are good to go. Thank you.